innovative intraoperative rapid detection test for visualization of Mucor. The Indian Prime Minister, on the evening of 24th March 2020, announced a nationwide lockdown in the wake of the deadly coronavirus, which was spreading like wildfire across the world. The COVID-19 pandemic shut down the country of 1.38 billion people, but the virus had no boundaries. It affected the health of millions, ranging from the young children to the old aged, with or without any systemic association. The first case in India was reported on January 30th. Subsequently, the number just rose uphill with no major improvement. This continued till a year, and then we saw the second wave of COVID pandemic in the year 2021. With the increased rate of infection, shortage of medicines, shortage of hospital beds, and increased oxygen demands. The population was only getting used to the coronavirus, and boom, there was another major outbreak in the country. It was a fungus this time. The mucormycosis saw a sudden rise in cases across the country, which especially affected COVID-infected patients, immunocompromised patients, diabetics with history of high-dose steroids or on oxygen supply. The black fungus, as many call it, was a major threat to vision and life, and the term was called rhino-orbital cerebral mucormycosis. Mucor has shown doubling of mortality with a delay of 6 days of treatment initiation. Hence, initiation of its evaluation and management was a crucial step for better prognosis. Extensive involvement of the soft tissue needed surgical debridement. It helps in reducing the disease burden and increases the drug penetration, arrests disease spread, and provides intraoperative samples for histopathology microbiological examination. The COVID pandemic led to travel restrictions, overworked doctors and laboratories with immense load of test results pending. That's when we needed a device which would help us identify Mucor on spot. And that's where we came across Iolscope. The Iolscope is a very simple device made out of a chart paper. By making holes into it, the intraocular lens of a 30 diopter IOL PMMA rigid was attached with the liquid adhesive. 3 other IOLs were then attached to it, one upon the other. And this setup was then put on a smartphone camera. The Iolscope was ready for investigations. Here we present a case of a 45-year-old male post-COVID recovery. On examination, his left eye showed proptosis, ptosis, chemosis, and restricted extraocular movements. The patient was sent for an MRI scan, and as you see, there was Mucor involvement in anterior ethmoidal sinus and orbital soft tissue. The only management was to conduct a surgical debridement of the involved tissue and extensively remove the affected areas. Here we can see a functional endoscopic sinus surgery being done on a patient with rhino-orbital cerebral mucormycosis. The specimen debrided by the surgeon was then mounted on the slide. At this stage, we came up with the idea of using Iolscope intraoperatively to detect the Mucor hyphae. The debrided specimen was placed on a KOH mounted slide, and the examination of the slide was conducted simultaneously with the surgery in the operating room. The slides show the presence of Mucor hyphae. It also helped in detecting leftover fungal tissue during the surgery. The specimen was also sent to the microbiology lab for confirmation after the surgery. Here you can see both the specimens taken, one from the Iolscope and the other from the laboratory microscope, showing the Mucor hyphae. The main purpose of this setup was to highlight the use of Iolscope in tackling the COVID-19 and Mucor doublet by ophthalmologists and otorhinolaryngologists as a reliable screening tool for rapid detection of hyphae for prompt treatment bypassing laboratory-based examination. It is also beneficial in hospitals or clinics devoid of laboratory setup and gives access to an expert opinion by microbiologists via telemedicine. Thank you.